Welcome to America's Heroes Group.
Good afternoon and welcome to America's Heroes Group Roundtable with partner National Nurses United. It's Saturday, March 19th, 2022. March is National Women History and Disability Awareness Month. I am co-founder, Vietnam veteran, and host Cliff Kelley.
Yes, the Honorable Cliff Kelley.
Thank you, sir.
And I am the co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith. Our digital media producer is the iconic Ivan Ortega of Scouts Honor Productions. And today we have a special guest, Adelena Marshall, who is a VA mental health RN extraordinaire. She does things for our veterans every day. And Adelena has the 911 on this issue we're going to talk about now. Our discussion is going to be about women providing healing and promoting hope. Hi, how are you doing, Adelena?
I'm fine, and hello to everyone out there, and thank you to this program for allowing us to have this voice to reach our veterans.
Oh, great.
Yeah.
Yeah, so tell us, what is this about, women providing healing and promoting hope? What's your view on that?
As we all know, that even in the beginning of World War I, women served on the front lines there as nurses, ambulance drivers, and relief workers. We had females who were physicians, and now we have many more of our veterans who are females, and we want to thank them. And from World War II, flight nurse, relief workers of our nation's earliest conflict, to active duty women serving our nation in uniform, to the VA staff at VA medical centers across the nation, and all women who served. We honor your service as you gracefully and compassionately, that's the key word, compassion, brave the front lines. And we here at Jesse Brown VA have many female veterans working there as doctors, NPs, psychologists, nurses, of course, in all fields. And we try to deliver a very compassionate care to our veterans. And it's the women that are in the forefront of delivering this care. And this latest episode of healthcare concerns that we're trying to maneuver and get back to normal is women who were out there delivering that care to our veterans, irregardless of the consequences to their own safe health process. So we just want to thank them. What I also want to bring to everyone's attention is that the VA now has a veteran eating disorder program, and we want to make sure all of our female vets understand that. And that was a grant was initiated through the Jesse Brown VA Health Program and applies to both males and females. Jesse Brown is also extending their women's health care. They're going to have a whole floor dedicated to all aspects of women's health. And this is where we want our veterans to come, because we understand we're compassionate towards them, and we want them to come there and to feel safe getting their health care there at Jesse Brown.
Yeah, that's fantastic, Adeline. Yeah, and I was thinking about, the Army formed the Women's Army Auxiliary Corps, also known as WACS, back in World War II, and was later renamed and restructured to form the active duty Women's Army Corps. So they call them WACS. And then also a branch also formed the Army's Women Air Force Service Pilots, called WASP. And we have to think about the Navy too. The women accepted for volunteer emergency services, they were called WAVES. And we had the Marine Corps with enlisted women in the Marine Corps Women's Reserve, and also the Coast Guard. So a lot of people don't really realize how important the Coast Guard is to our national security. So the Coast Guard formed the Women's Reserve, or SPARS. So this is the Semper Paratus is always ready is their motto for the Coast Guard. So it's really incredible. And I ran across one thing. It was in England in 1945, and there was a wax major, Charity E. Adams, and Captain Abby N. Campbell, and they inspected the first contingent of black members of the Women's Army Corps assigned to overseas service. So that was the first one, and it's incredible. We need to really think about this history and why, our elections are so important, because in 1967, President Lyndon Johnson, opened the promotion of women to general and flag ranks. So elections matter, right? And what we do.
Elections matter.
Yes, yeah.
They sure do.
So what do you think is the, what's the message here for our, our congressional members and for those people who are empowered about what the importance of women are and their role in the military? What kinds of support do they need to carry on this mission of providing healing and promoting hope?
So we know that in World War II, there was over 59,000 nurses serving on the front line in the Army Nurse Corps.
Mm-hmm.
And also many of the women that you mentioned and other women joining various departments in the military, they faced a lot of discrimination and criticism when they prioritized serving their country over taking care of their families. And our representatives need to understand that the women have to be viewed as equal to any man on the front lines or in any of the military departments. And also their leadership ability is very important. Women have a strong voice in what happens not only in the United States but in the world. Mm-hmm. And our representative leaders, that's just another way to they're outdated in their thinking, mm-hmm. and they need to do funding and do surveys and have panel discussions on how they can improve upon women's life in the military, mm-hmm. and also in women in general.
Okay. And how does this play into the role of healing that you see, in the VA system? Because you're intimately involved in that, and I know you do more hours than they pay you for, and put in more time. Many of the nurses do, and we've talked about this particular issue before about we need to have more nurses, available for veteran care, and that more funding needs to be attributed to that. So what do you think that the lack of having that additional nursing staff does to the women who are actually providing this healing and promoting of hope? What does that do to them?
Well, what it does, it decreases the amount of time mm-hmm. that we have to spend with each veteran. Mm-hmm. So even just recently, we had a female vet leave because she didn't feel comfortable in the environment that she was in, and we tried the female nurses. We tried to encourage her that if she needs us to come back. The VA is, I think, do have the message. It's just that they need the funding, and right now, as we know, nurses are in very, very short supply. If you listen to the Veterans Affairs on Thursday, Congress was having talks about this, and it was very, very interesting. They are now ready to start looking at providing more programming through the community colleges so that we can produce more nurses and get them on the forefront. Those nurses who come through community college, many of them have worked as nursing homes and as LPNs, and they're the first line personnel who are delivering this kind of care to patients and to our veterans. I do believe they make very, very good nurses because they have that compassion. Mm-hmm. And this is what we need. Sometimes we just have to be quiet and listen and to understand the pain and stuff that many of our veterans experience. And just this current, I don't know what we're going to call it, over in Ukraine is really causing a lot of pain for our veterans to have to hear this on the news and, mm-hmm. See what's going on. Brings back bad memories. So we don't have the staff. We don't have enough mental health staff to support their needs right now. and we don't know how long this conflict is going to go, and each day is causing a lot of pain to our veterans here in the United States and who have served this country with, passion and commitment. And now our representatives must also see that the needs of the veterans is constantly increasing. And we need staff that could manage that. Because many of our veterans that come in, they come in with multiple problems. They don't just come in with, a broken arm or a broken leg or a headache. Once we start looking at that, they have many other problems. And so just yesterday, I met with a group of nurses. The VA has started what they call a PAVE program, and we're trying to identify veterans who have vascular issues with their leg because many of them are losing their legs due to poor circulation. So we met yesterday. There was probably at least 12 of us trying to decide how we can deliver this care to our veterans. And we want to start in dialysis because many of our veterans come from dialysis. Of course, they have diabetes, but many of them have vascular problems that don't have diabetes. So we're trying to think out of the box how to reach this sector of our veterans who may not follow up. So if they don't go to the doctor, well, we're gonna lose them because they're not going out to get the care they need. So we need to identify their needs when we have them there with us. We need to talk to them. We need to have time, to say, well, hello, Mr. Jones, how are you doing today? Is there any concerns that you may have? And, they may not tell us right away. So we got to have that cultural competency to realize how do we reach them? How do we get to talk to them about their health care? How do we work with them to extend their lives and the quality of their life that they have? And that's another reason why we need more staff, actually, in every department, but especially for those of us that are on the front line working with our veterans.
I've been fortunate enough to go to a couple of the hospitals and talk to veterans, which is a great thing to do. But I don't see as many as I used to. Is there a difference there?
Well,
you know what I'm saying? I used to just go, yeah.
Yeah, some of them now will seek care in a private sector, but the private sector will only treat you for what you come in there for. We treat the whole body and spirit of veterans. And actually, Jesse Brown's veteran population has increased over the years. And we, the VA is talking about reorganizing and opening up other areas and closing some down. But Jesse Brown, due to the sheer volume of veterans that we get coming in, they're extending programs to assist them. And I guess with the last 2 years or so, COVID, some people are getting telehealth. And so we've expanded that group of nurses to be able to reach out to our veterans over the phone or via Zoom. So that can also be a reason why you don't see as many because they're receiving health care in their home environment.
Yeah, that's really interesting, when you were talking about the PAVE program, Adelena, because it automatically made me think about us being in a pandemic right now with COVID-19, and we know that organism, that virus, actually attacks blood vessels. And so we've been seeing indications of, long hauler syndromes and, potential heart, kidney, and brain involvement and lung involvement, liver. And, the thing is that it's going to cause a greater need in the future from what we're seeing right now, and that you're going to need more care. As a matter of fact, back in, I think it was in May of 2020, they actually started noting from CMS, from the Center for Medicare and Medicaid Services, that if you were on dialysis, you were 11 times more likely to be hospitalized. So those people you were talking about, the veterans who are on dialysis, are at greater risk. So you need more monitoring in that situation, and you probably will need more care. Yeah.
Well, one thing that came out in the meeting yesterday was staffing dialysis as 1 to 10 patients, and we're trying to address that to get more nurses so they can have more time with their patients who do come in with a lot of comorbidities. So we would like to see that reduced to maybe 1 to 7 or even 1 to 6.
Okay.
Or depending on how sick the patient is, we might have to have a 1-to-1. So, you know, we are talking. Actually, the undersecretary of the VA was at Jesse Brown last Thursday, and we brought this to his attention that staffing should not be based on a methodology that's based on budget, but on the needs of the veterans that are coming there and their acuity. And so he did take notes, very attentive to what we had to say, and even extended the meeting by about 7 minutes so that he can hear everything that we were telling him.
I don't disbelieve that at all. I've been to Jesse Brown and made some comments and statements to people. That the folks were just great. They were attentive, and it really went well. Every time I've been there.
Yeah, you know, Adelena, you started this whole thing, the discussion, Cliff, but she started the whole discussion about women providing healing and promoting hope. And, you know, just by listening to you, it sounds like those qualities are coming out of you so strongly. You know, you're the role model for, what really can come out of this, because you're concern in your voice for these
we have many nurses in the VA that advocate for patient care. You should understand they went to war. We're going to war for them. We're because of the union, which many of the private sector doesn't have it, and the staff fearful of saying anything. But we had a very robust discussion yesterday about that foot care and making sure that the veterans that are coming to us are going to be addressed earlier in their care needs versus waiting too long and then they start getting gangrene and things like that. I mean, one nurse told me she was walking past a patient and she had, she just smelled something and she could not leave to go home. She stayed there and had him take his shoe off and found out that 2 of his toes were gangrene. And then she got him care right then and there. So that's a commitment that
that could have been very serious for him. Yeah.
But this shows you that the nurse noticed something, didn't see it, could have went home, was on her way home, but decided to stay and asked that patient to let her see his foot, and then took the proper action after she saw that he had 2 green toes. So we're not, another thing at the VA and with the union, we don't limit our nurses to the time that they spend with a patient. There are organizations that will time you, so they have these hand washing things in front of the door, the sanitizer, and it times you when you come in, it times you when you go to the sink there to wash your hands, times you when you go out. We stood against that because we don't want our nurses' time as to the amount of care and the time that they take to deliver that care to our veterans.
Yeah. Well, we're running out of time, but I want to really commend you for the work you do every day. And, I served with many women in combat over in Iraq, who were taking care of our wounded soldiers and who actually were on the combat line. And I just want to do a shout out to all of them. They were phenomenal during all of my tours overseas. And I just want people to, educate themselves, go and look up these remarkable women in history. And they should be part of our national heritage and our acknowledgement of their great duty to us. So I just want to thank our partner, National Nurses United. Adelena Marshall, you work as a wonderful example of what someone should be, and you are just really paving the future. and I'm hoping that they do listen and giving you the nursing support that you need, because you are really working on behalf of our veterans.
I want to let our female veterans know that there is a call center and free service available to them.
Okay.
And I do have that number
Okay,
for
sure.
them if I want to get a pen and pencil.
Sure.
But it's 855-829-6636, or you can text 855-VA-WOMEN. But we have a nice center there. We want them to come in and let us collaborate with you on your health and to get you on the road to good health and longevity.
And where's that located for them?
It's Jesse Brown.
Okay, right.
That's for the Women's Veteran Care Coordinator Program. It's a Center for Women Veterans.
Okay, fantastic.
And we're able to do their mammograms very soon. We're also promoting for women with PTSD. If they are trying to start their families, we'll have support for that too.
Fantastic. Adelena Marshall, you walk on water. You're one of our angels. So we are, that number is 855-829-6636 and or 855-VA-WOMEN. So we are so pleased and honored to have you, and we're going to be holding. I want you everyone to hold on. We're going to have one more segment, and you don't want to miss it. Congresswoman Lee will be on and be talking about women's history.